Good afternoon, and thank you everyone for joining me today for another Leadership Dialogue session. I'm John Haupert, President and CEO of Grady Health System and Board Chair of the American Hospital Association. I'm looking forward to our conversation today as we talk about a very important issue, but also one that is a core mission of our field, and that is engaging in activities and providing services that benefit our communities, truly impacting the lives and well-being of individuals and improving community health. We have seen criticism by some, or maybe it's just a lack of understanding, in regards to how hospitals and health systems work to provide benefit to their communities outside of the high-quality medical care they provide. But the truth is that there is so much good being done by our field to advance health and make sure those we serve have access to the services and supports they need in order to recognize their potential for health and well-being. At Grady, like other organizations, we are deeply committed to meeting the unique needs of our patients. For example, we established a food as medicine program whereby our physicians can write prescriptions for nutritious food and nutrition counseling and cooking counseling for our patients. And over time, we have proven that that program has significantly reduced A1C levels in the individuals who were part of that program. And while the programs and approaches might differ from hospital to hospital, each organization is working to meet the unique needs of their local community. So now let me introduce my guest today, Doug Brown. Doug is President of Community Hospitals and Chief Anchor Officer at UMass Memorial Health. UMass Memorial Healthcare is a nonprofit healthcare system that encompasses a multi-campus academic medical center, 3 community hospitals, a physician practice, and related entities. Doug oversees the system's 3 community hospitals and its behavioral health provider. Doug has also led the organization's pursuit of an anchor mission, which reimagines the role that UMass Memorial Health plays in the community. It does so by leveraging its economic power to address social disadvantage and pervasive inequality. Doug is a fellow AHA board member and also serves on the selection committee for AHA's Foster McGaugh Prize, which recognizes hospitals and health systems who are working collaboratively to improve health. So please join me in welcoming Doug.
Hi, John. So great to be here.
Well, we're glad to have you. So let's go ahead and jump into a few of our questions today. The hospital field has a long history of helping to address unmet health needs within communities and have been committed to community health improvement tailored to the specific needs of the communities we serve. Can you share a bit about UMass's community benefit history and then your journey from more traditional community benefit activities and services to community investing?
Absolutely, John. It would be my great pleasure to do so. So I've been at UMass Memorial for about 20 years. When I came, we had a CEO who had come from Cambridge Health Alliance in Massachusetts, which was a public hospital. He also served as the public commissioner of the city of Cambridge and had a real passion for public health, and so really helped us chart a course to get outside our walls and impact our community. And so we started a care mobile that provides dental and medical coverage to 20 schools in 10 different neighborhoods around the city. We started community gardens, and we started a PD asthma program, among other things that has really helped us engage with our community in exciting ways. And so we've been on that journey. We were a finalist for the Foster McGaugh Prize, the AHA's highest prize for community benefits in the last several years. And then in around 2017, we launched this anchor mission, which, as you noted, was all about reimagining the role we play in our communities and having a real different mindset.
So in mentioning the anchor mission, that's unique and clearly has become a real focus for your health system. Can you share with us what that journey has looked like and share with us what were your initial areas of focus?
Absolutely. So the nature of an anchor mission is a recognition that as a nonprofit organization, we are kind of what's considered a sticky asset. So we are in our community. Unlike investor-owned or for-profit organizations, when times get tough, we're not likely to ship up and go to some other community. So our future is determined. It's connected deeply to the community's future. And we looked outside our walls, John, and I think the epiphany for our organization was looking at life expectancy. And we know in our city, which is replicated all across the country, we have one neighborhood where the Worcester Red Sox play in a new Polar Park that has a life expectancy of about 74 years, and that's 11 years less life than a neighborhood 2 miles to their north. And it all has to do with the conditions of those two different neighborhoods. So we felt that we couldn't be authentic to our mission unless we started to address those social drivers of health. So an anchor mission is simply a method of leveraging all of our assets, the full economic and intellectual power of our organization to lift up the community and address social disadvantage and pervasive inequality. And we do it in three primary ways. We use our investment power to redirect some of our investments to community investments from stocks and bonds. We use our purchasing power to, in our case, we pledged to triple our purchases in minority and women-owned businesses in our community over the next 5 years. And we use our hiring power to start maybe looking in some of the more socially vulnerable neighborhoods to hire where we wouldn't typically look for traditional candidates to help improve lives in those communities.
Great, thank you so much. And can you share a little bit more with us about how you have leveraged your investment strategy, your community investment strategy, to impact your community?
Yeah, so that was really the first area we targeted, John, and we did it in around 2018. Um, and we joined a few other organizations around the country that took a pledge to take 1% of our investment portfolio and to redirect those investments. And so in our case, at the time, our investment portfolio was $400 million. This is a long-term investments. So we took $4 million and we committed it to the community. And we now, several years later, have 10 investments that actually total more than $4 million. And they typically are short-term investments for pre-development financing that a lot of small nonprofits need to help get their projects underway. So we invest in a project in Fitchburg, Massachusetts, that is a affordable housing project that is giving preference to local artists in the area. It's closely affiliated with the Fitchburg Art Museum. We're very excited about that project. We have some projects we're investing in a community development corporation that's buying up blighted property in a vulnerable neighborhood and building first-time homeowner homes in that block to help turn around the neighborhood, give an opportunity to a family that wouldn't otherwise be able to get in. And we have projects for chronic homelessness, other projects for arts and community building. So it's very exciting for us. And these are not grants. That's what I think for some is hard to understand. Community benefits, our program, like all hospitals, we give out grants, and we're proud of that, and that will always be necessary. But this is a very different way of thinking. Grants are kind of one and done, and once the grant is gone, either there has to be new grant money or they have to find money somewhere else. Our approach is to supplement that by providing investment vehicles to stimulate other investments and to be sustainable over the long term to help turn around communities and promote development.
Well, and I'm so glad that you shared that story because more and more we're seeing community investment take that form. And really, those are kinds of projects that wouldn't happen otherwise without that type of community investment. So from a leadership perspective, what goals and objectives have you set as it relates to your community investment strategy?
Yeah, so in our case, John, when we developed an anchor mission, it really was very important for us that it become part of our strategy. We didn't want it to be a one-off and fall by the wayside in difficult times. And so we made it, we embedded it in our overall strategy. We have a strategy wall in our boardroom, and we are big into metrics. And so we've got it on the wall, as they say. And when something gets on the wall, it's important in our organization. So it's right up there for everyone to see, for our board, for our executive team. We also we built specific metrics. One of the exciting things we did is we built it into our annual incentive goals, which affects hundreds of people in our organization. So 20% of our goals are around equity. We have specific anchor mission goals, and they have to do with the number of people we'll hire from socially vulnerable neighborhoods. It has to do with the amount of investment money in anchor investments we'll put out there. Like you, we have a food as medicine program. So this year, one of our goals is the number of individuals we'll serve in that program. We also build it into things like our orientation for new caregivers, because we think it's important for them to start understanding this concept and seeing our organization as not only one that provides great health care, but also one that gets outside its walls to help promote health in the community. That's some of the ways we do it. I think the nirvana for us is that big dot metric, right? These things they take time to change lives and neighborhoods and promote health. So we're really giving a lot of thought to what's that big metric that we really want to track, whether it's life saved or closing the gap in life expectancy, and there are a number of others. And we're in the process of thinking that through so we can really guide this work over the long term.
Well, clearly you have done a lot of work with your board and have achieved engagement with your board around support for these types of investments. How do you use your board members to not just endorse, but to champion and guide your work?
That's a great question. Well, it started that the idea came to us actually at an event, a conference I was at with our board chair. Now, our board chair in our case happens to be a professor at the Harvard School of Public Health. So I had an ally who was, made up for this type of work. And we came back and really thought that this is something we could do in our organization. So he's been a huge champion, and he's actually spoken to other organizations and other trustees to let them know this isn't scary, and it's very doable. And so that's been very helpful. We've also we've gotten a lot of help from our investment committee. They were the first stop in our journey, and they, investment types, and I love them all, are fiscally prudent, conservative people by nature. And so the idea of taking 1% and redirecting it to community investments, as you might imagine, wasn't the easiest sell to begin with. But in our case, they immediately got it. They understood it. They knew that we were still seeking to get our money back, just perhaps instead of at a 7 or 8% return, we were looking to cover inflation. So maybe 1 or 2%. And then put it back out into another form of community investment. So it was a much easier play than we want, and our investment committee has been very involved. And the last thing I'd say is that I have found that this resonates with trustees. Most trustees I've experienced, John, I'm sure the same is true for you. They came into our organizations because they really want to help the community, and they may not have as much depth in healthcare operations as we do, but what they do know is how to benefit the community. And so we found that our board members were really energized and excited by this work and the opportunity for our organization to be helping to promote a more just society outside our walls. And they've been true champions in so many ways.
Well, and a lot of what I like about what you've been talking about is that through everything you said, obviously the culture of your institution supports this work as well. So can you share some advice or lessons learned for other CEOs and senior leaders beginning this work, particularly those with maybe a smaller footprint or not as many financial assets?
Absolutely, and we've learned a lot of lessons out there. So we joined an organization called the Health Anchor Network, which is made up of a number of health systems trying to do this work. And one of the beautiful things about participating in this group, and we've had local convenings of other anchor organizations, is that we're all in it together. No one has there's no kind of perfect secret sauce. Everyone does it a little bit differently, but we're all trying to help each other make progress. What I would say if you're starting is find ways to inspire your board. We found the CEO of ProMedica, they were about maybe 5 or 10 years ahead of us. And we had him come and talk to our board at a retreat about their journey. And that was incredibly impactful on our board. There are plenty of organizations out there that would love to tell their story and share what they've learned, both the missteps as well as the opportunities. And we certainly would be happy to do so because we've learned from many others. I would say start slow. Don't try to boil the ocean out of the gate. You could tackle hiring. We started with investment. Some have started with hiring. Some have started with purchasing. It really doesn't matter. I just get your toe in the water. Engage your employees. Another thing we've found, John, is that while it was important to get the top of the organization involved, this has grown organically from the bottom of our organization or throughout the organization, and that's really what has accounted for its sustainability more than anything. Every time I talk to a crowd in our organization, I invite them to come involved, and I always have 1 or 2 people volunteering, and it's really become kind of permeated throughout our organization. And I think our employees are beleaguered right now. It's such a tough time to be a healthcare employee, and when you can give them a chance to work on something larger than themselves, it really can help them connect to purpose while they're at work. And I found that to be maybe the biggest surprise and the biggest benefit of this work. I guess the other piece I'd say to remind people of, we're not talking about coming up with a lot of new money. It's hard in our environment when we're so financially strapped to think, oh boy, I have to come up with some new funds for this. Everything I've described is redirecting existing funds, right? And that's, I think, sometimes hard for people to understand. We spend about $1 billion a year buying stuff, goods and services. We're not going to add this. This effort is just redirecting some of that $1 billion to serve a different purpose. We still need to buy high quality, low cost goods and services, but maybe we can do some of that with individuals, particularly minorities and women that own businesses that we haven't looked to before, and we can pursue other goals in our community. Same with investing. We're still investing. It's just a different form of investment. So I think that's helpful to understand, is that it's not like, it certainly takes time, no question, and leaders, but it's more about redirecting existing spending than coming up with new money.
Well, and I think I love the point you made about engaging your employees, because I'm sure they're very proud of the work that the organization is doing in the community. It's very visible. And it's something that they can buy into and really will develop a sense of pride in the organization. So, Doug, I want to thank you for joining me today. I appreciate you sharing the great work you're doing at UMass to improve the health of the community, and specifically your insights on community investing. I know that many institutions in the field can learn a lot from the work you're doing, and we may actually take you up on your offer to share that with us. As I said earlier, not all hospitals and health systems will be taking the exact same approach, but they are all deeply committed to supporting the unmet needs within communities to help advance health and well-being. Until next time, thank you to everyone for joining us today. I hope you will be back for next month's Leadership Dialogue. Thank you very much.